This is a review of a paper which looked at thick endometrium and is it associated with hypertensive disorders of pregnancy. And what they noticed was that a thick endometrium of more than 12 millimeter is independently associated with increased risk of developing hypertensive disorders of pregnancy. The optimal endometrial thickness to reduce the risk seemed to be between 9 and 10 millimeter, but remember, it's very difficult to control this. Also remember that as you give estrogen, it is very variable which woman would have a thicker endometrium and a thinner. What it also suggested that the risk of cesarean section was much higher if the endometrium was less than 8 millimeter, and that also that the risk of placenta being adherent to the anaprevia or a previous scar was much higher. Now, one of the things which we think is happening is that the endometrium gets thicker. There seems to be vascular remodeling that occurs, and this remodeling may be causing more hypertensive disorders of pregnancy. Again, these are very few studies, and we should keep in mind that in cases where there's a thick endometrium often occurs in PCOS, where the risk of having hypertensive disorders of pregnancy is also increased.